Hi, I'm Dr. Mark Jagger. I am creator of the Spine Specialist and Clinical Director of Spine Advanced Mississauga. I wanted to film a little video here just to give you a bit of a tour and orientation of our Mississauga clinic. So what I'll do is I'll flip the camera around so you can see this is our reception area here. So waiting room reception. This is one of the rare occasions where I'm here by myself, so I'm able to film the video and show you what you're going to see when you come in. So in the hallway off to the left here is room number 1. This is where we do spinal decompression with neck, and we do knee decompression, something very unique to our office. I developed the program called Laser Assisted Meniscal Decompression, and I have trained doctors all over North America on how to do it using a traction device and a few of the other little things we've devised in combination with laser therapy. So we do laser therapy and decompression of knees, hips, backs, and necks. So that's one of the things we do in room 1 here. In room 2, you'll see a device called the Spine Specialist. So this device is the one we have actually designed. It is essentially a combination of robotic laser therapy. So you can see a little laser robot down in here that we developed. The laser unit and the software, and it is embedded into a spinal traction table, so spinal decompression. So traction, decompression is computerized traction essentially. So what happens is the laser moves around based on the diagnosis, so I can send the laser wherever your problem is, and then at the same time the table opens up and will actually traction the spine, so you can see how the table stretches like that. So we've combined robotic laser therapy and spinal decompression all in one system. And we're actually the manufacturer of these tables as well. We're manufacturing for doctors all over North America. So rest assured, being the one that's developed the entire concept, we surely know how to use it to your benefit. So coming down to the next room, down the hallway off to the left here, is room 3. This is our assessment room for the most part. We also do acupuncture in here, laser therapy, some of the physiotherapy, osteopathic, and chiropractic adjustments. We also have something in here that is quite unique. It's called a Pro Adjuster. It's a computerized adjustment tool for spine and for joints. Now, where the big benefit is for this is some people don't want to be regularly adjusted manually like the regular old school chiropractic stuff. A lot of people still tend to like the old school chiropractic stuff, but some people want something that's a little more gentle. This is a little more technologically advanced, so we can adjust the spine using that tool on the table right here and have before and after assessment through the computer sensors that are actually embedded in the tool. So it's a very high-tech type adjusting, and that's really a lot of what we're into here is using technology for the betterment of the patient. So we still have all the old methods available, but we wanted to make sure that we brought on the newest and the best of technology, because that's what can really help a lot of people that haven't been helped by the regular traditional stuff. So we want to make sure that we have access to all that for the patients that can benefit from it. So in here we have something called the ProSoft. It's a similar device to what you saw in the other room. It's just a little more focused on muscles and a little bit, a few other protocols like balance protocols, things like that. So it's more of a soft tissue adjusting instrument than it is a spine adjusting instrument. So we have the option of those two depending on what your condition is. We would use either one of those two devices on it. So now down here on the floor that you see glowing red, this is something very new to our office. It's actually called laser current neuropathy therapy. So for patients who've got numbness and tingling in the feet, whether it be from diabetes, drug side effects, can be from chemotherapy, just general aging process, reduces circulation in the extremities, and you get numbness and tingling and pain in legs, feet, hands. This device has been designed by us actually to specifically help that. What it is a microcurrent, which is a low-grade electric current. Many people who've been through therapy have probably had something like that before with the electrical current. This is very imperceptible. You don't feel the current. It's just low enough that it helps the cells communicate and helps the nerves regenerate. In combination, why it's glowing red is we've actually embedded a laser into the regular device that delivers the current. So there you go, the laser goes off on a timer. So there's a laser in the floor of this which actually helps increase the circulation, open up the blood vessels, and improve sensation in the feet, along at the same time having the electrical, low-grade electrical current going through as well to help patients with neuropathy. So next thing is our shockwave machine. So shockwave can be helpful for a lot of different conditions. You can see in through here for elbow, knee, shoulder, hip, pelvis, hand, low back, feet. So what this does is it's a little bit more aggressive than the adjusting tool that I showed you before. What it does is it delivers a percussion to try to help break up scar tissue. It can break up calcification. It can reduce inflammation. It creates a little bit of trauma in the tissue, basically to help the tissue heal. So creating a little bit of trauma makes the tissue swell a little bit, brings circulation in to flush out all the junk and all the damage that was in there before. So plantar fasciitis is something, heel spurs, that's something that we use it on, or some other more resistant joint issues. When other things don't work, we use a shockwave. So on to the next room. Room 6 here. This is the very first spine specialist device that was ever devised. This is prototype number 1. So back in 2013, we finished this prototype, and it's been in use in this office ever since. Next room is the bathroom. You don't need to see that. They pretty much all look the same. And room number 5. Room number 5. This is where we also do knee, hip, and neck decompression, kind of like room number 1. Off to the right, we also have a device that does body shaping. So cryolipolysis, or some, the functional name for that has been cool sculpting. We also do ultrasound cavitation for fat loss. So we combine cryolipolysis, which is these paddles here, and ultrasound cavitation, which is this paddle here. The cryolipolysis freezes the fat. The ultrasound improves the circulation and breaks up the fat cells to actually help metabolize them. And then after that, we use laser therapy to help flush everything out. So it's a kind of interesting combination of using a few different technologies to get a hot-rodded result for fat loss. So that's pretty much this clinic here. Coming back down the hallway to the reception area, something that I also am quite proud of in this office. I really like motivational sayings, because you never know what you might see that may inspire you, keep you inspired, keep you motivated. I think this is a very, very overlooked concept with respect to people trying to get out of pain and back to function. And one of my favorites here, Great Canadian, you miss 100% of the shots that you don't take. And healing is a matter of time, but it's also a matter of opportunity. So I wanted to do this video so you'll feel a little bit more comfortable taking that shot and seizing that opportunity. Thanks so much for watching this video. I hope this gives you a little bit of an idea of what we do here at Spine Advance Mississauga. We do have a number of associated clinics that have our spinal decompression devices, the robotic device I showed you, and the neuropathy devices. If you're not in the area of Mississauga, there are a number of different clinics across North America that actually have our equipment as well. And we would be happy to help you or anyone that needs the type of specialized help that we provide. Thanks so much for watching. I look very forward to meeting you and helping you any way we can. Have a great one.